my name is Ashley Steer, and I am a nurse practitioner student. How are you today?
I'm good.
Good. I'm going to be doing your physical exam today.
Okay.
Just like to start off with, what is your full name?
Daniel Steer.
Good. And where are you at right now, Daniel?
I'm in your office.
Good. And the year?
2019.
Okay. Just noting his general appearance. Daniel is well groomed, he's clean, and he is in no acute signs of distress. Before the exam was started, we took Daniel's vitals. His blood pressure was 124/60, heart rate of 80, pulse ox of 99%. His respiratory rate was 18, and he is 98.6 degrees Fahrenheit. His height is 5'11 pounds. He weighs 190 pounds. His BMI is 26.5, which is just slightly over ideal body weight. His visual acuity was tested as well before the exam. Daniel was able to read off of the line 8, which is 20/20 vision in each eye. The first exam I'm just going to note is just his skin. He's nice and warm and dry and appropriate for race. Next thing I'm going to do is just do a head assessment, checking for any tenderness. Just let me know if you, any pain.
No.
No? Good. I'm looking for any rashes, wounds, anything like that. No infestations, and his hair is clean. The next thing I'm going to do is just palpate for his temporal arteries. Good, +2. And then go down to the masseter muscle. Go ahead and clench down for me. Perfect. Open your mouth and close. Any pain at all?
No.
Assessing for TMJ. Good. And then the next thing I'm going to do is just test his facial symmetry. Go ahead and smile for me. And then lift up your eyebrows. Good. And then puff out your cheeks. Perfect. And then stick your tongue out midline for me. Good. Okay. And then the next thing I'm going to do is just assess his sensory. I'm going to touch your face. Go ahead and close your eyes. Touch your face with a dull and a sharp object. Just let me know which side and if it's dull or sharp.
A left dull. Right sharp. Left sharp. Right dull.
Good. And did that feel equal on both sides?
Yes.
Okay, and then the next one I'm going to assess is his vision. We already talked about the Snellen chart. Go ahead and I'm going to assess for confrontation. I'm going to have you cover this eye over here, and then just keep on looking at me in this eye. Don't turn your head or anything, just keep looking in my eye. As soon as you see me wiggle my fingers, just let me know, okay?
Okay. Okay. Okay.
Okay, we'll repeat on the other side.
Okay. Okay.
Good.
Okay.
Perfect. Okay, and then the next test that we're going to do is just assess his 6 cardinal views of vision. I'm going to have you follow this for me, okay? And assessing for extraocular movements. Okay. And there was no extraocular movements, no nystagmus was noted. The next thing I'm going to do is just assess his pupils in general before we shine any light. His pupils beforehand are equal. They're about a +5, +4. Now I'm going to, and they're regular in shape. I'm going to assess with the light stimulus. Go ahead and look straight at my nose here. Good, keep your eyes open. Good. And his pupils constricted down to a 3, and they were equal and reactive to light. Next thing I'm going to do is just check for accommodation. Go ahead and look at this for me. And I'm assessing to make sure that, good, both of his eyes came in equally. The next thing I'm going to assess for is the consensual. Both, and go ahead and just look straight forward at my nose. As I shine the light in to this eye constricted at the same time, so he is intact consensual vision. The next thing I'm going to look at is his eyes, their appearance. The sclera is nice and white. I don't see any redness. The pupils and the iris are both regular in shape, no irregularities there. No drainage, no redness to the eyelids, no styes. Next thing I'm going to look at, go ahead and look up for me, is the conjunctiva. They're nice and pink. And then the next thing I'm going to look at is his red eye reflex. Go ahead and look off in the distance for me. I'm going to come at a 15-degree angle. And he has a positive red eye reflex. I'm going to come in a little bit closer, sorry. And then I'm checking. The fundus is orangish yellow in color. And looking at the vasculature, I'm going to try and keep your eye nice and open for me. Looking for the optic disc. Is yellow in color, circular in shape. Good. Vascular is intact. I didn't see any papilledema. The next exam I'm going to do is the ear exam. Looking at the external ear, I don't see any redness. There's no lesions or anything like that on his ears. I'll assess the Weber and Rhine test first. First is going to be the Weber test. Can you hear this?
Yes.
Okay, let me know when you can't hear it anymore.
Okay.
And then the next test is going to be the Rhine.
Okay.
You can't hear it anymore?
No.
Okay.
Yes.
You can hear it? Okay. And that is to assess air conduction is greater than bone conduction. And of note, too, back when I was assessing the eyes, I would assess on both sides as well. Now I'm going to assess the internal canal of the ear. On my way in, I'm noting that there is no debris, there's no redness, mild amount of cerumen. I see the tympanic membrane, it is intact. Gray pearly in color, and I see the bony structures are intact. And that the cone of light is in the 5 o'clock position. I would repeat this exam on, excuse me, the left side, and I would expect the cone of light to be in the 7 o'clock position. The next thing I'm going to assess is his nose. Just looking for any septal deviation or anything like that. Go ahead and just give me kind of a sniff test on each side. Okay, good. For patency, go ahead and close your eyes. I'm going to assess the cranial nerve 1 and assess your smell. Can you smell this?
Chocolate.
Good, and he's correct. The next thing I'm going to assess is the inner part of his nose. Lift the tip up. I don't see any redness, any drainage, no ulcerations, and I don't see any polyps. The next thing I'm going to assess for is his frontal and maxillary sinuses. Go ahead and look towards me. First will be the maxillary. I'm just going to push a little bit of pressure. Any pain or tenderness? And how about up here?
No.
Next thing I'm going to do is look at his oral mucosa. Go ahead and open up. Okay, everything looks nice and pink in there. I don't see any white patches, no lesions or ulcerations. Go ahead and stick your tongue out midline. Good, tongue is midline. Checking his tonsils. Go ahead and say ah. Good, tonsils are nice and pink. And the uvula is midline. I don't see any exudate or drainage or anything like that. And his teeth are also in good condition as well. The next exam I'm going to do is just looking at his neck. I'm going to defer doing the carotid arteries until we do the anterior portion of it. So I'm just going to start with the range of motion. Go ahead and look up for me and down and left to right. Good. And then kind of just give me a rotation. Any pain or tenderness there?
No.
Good. Next thing I'm going to do is I'm going to assess your lymph nodes, your glands, pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, cervical, posterior cervical, and subclavicular. I don't feel any gland enlargement, no lymphadenopathy. Next thing I'm going to do is I'm going to come around to the back side and assess for his thyroid. I don't feel any thyroid enlargement, any nodules or lumps, any tenderness at all.
No.
Good. The next thing I'm going to assess for is his sternoclavicular area, acromioclavicular. Any pain or
No.
tenderness here? Okay, go ahead and give me a shoulder shrug. Good. I'm going ahead and examine your range of motion. Go ahead and flex up and down, abduction, adduction. Okay, I'm going to assess your epitrochlear glands. Any tenderness back here?
No.
Okay, assessing the range of motion, pronation, supination. Any pain?
No.
Good. Assessing the brachial artery. Good. Radial. Both are +2. I would do this bilateral. Next thing I'm going to do is check his axillary lymph nodes. Central, lateral, and subclavicular. I don't feel any nodal enlargement. The next exam I'm going to do is assess for his strength. Go ahead and give me a grip strength. Good. Pull towards you and push away. Good. And he's 5 out of 5. Next thing I'm going to do is I'm going to assess his carotid arteries. First I'm going to palpate. Good. And then I'm going to listen for any bruits. Okay. Deep breath in and hold it. And no bruits were heard. And the next thing I'm going to do is just assess his general anterior chest wall. His anterior chest wall, anterior to posterior to lateral, is a 2-to-1 ratio. There's no barrel chest or anything like that. I'm going to listen to his heart sounds, starting with aortic, and then pulmonic, tricuspid, and mitral. S1, S2 are all normal. I don't hear, it's a regular rate and rhythm. Now I'm going to listen for any murmurs in the same sequence. I didn't hear any clicker murmurs or rubs. Assessing for the PMI, going down to the 5th intercostal space, mid-clavicular line. Okay, good. And then the next thing I'm going to do is listen to your lung sounds. This will be bronchovesicular. Deep breaths in and out. And vesicular. Good. At this time, if I would defer a breast exam, but what I would be looking for in the breast exam would be, I would inspect for any dimpling of the breast, any masses or lumps, and then I would be assessing for any masses along with any tenderness. The next thing I'm going to do is I'm going to palpate for tactile fremitus. If you could just go ahead and say 99 for me.
99, 99, 99, 99.
Good. And that was I could feel the vibrations bilaterally. Next thing I'm going to do is percuss. Okay. And that was bilaterally equal as well. I did not hear any dullness that I would think that there was any consolidation or anything. Next thing I'm going to listen for is agophony and bronchophony. If you could please say E for me.
E, 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 E.
Okay. And in all lung fields I heard were E. I did not hear the A, so I didn't suspect any consolidation. Go ahead and say 99 for me.
99, 99, 99, 99, 99, 99.
Good. I was able to hear 99 in all the lung fields. Now I'm going to listen to your lung sounds. Just go ahead and give me deep breaths in and out. Good. And taking note, his lung sounds are clear to auscultation, anterior and posterior bilateral. The next exam I'm going to do is checking for CVA tenderness. I'm going to pound on your back. Let me know if you feel any tenderness. Any pain at all?
No.
Okay. No pain to his kidneys. Next exam I'm going to do is his abdomen. First I'm going to do is I'm going to inspect his abdomen and just noting the overall color. In his contour is flat. I don't see any pulsations, no masses or lumps or anything like that. The next exam is going to be auscultation of his bowel sounds. Bowel sounds are normal active in all 4 quadrants. Next thing I'm going to do is listen to the vasculature, starting with the aorta, listening for bruits. And then the renal arteries, iliac arteries, and then I would also do the femoral arteries as well. I didn't hear any bruits. The next exam I'm going to do is percussion. Okay. Timpani is heard in all 4 quadrants. I didn't hear any dullness. The next exam I'm going to do is just assessing for the outer edge of the liver. And the liver is within the costal margin, so I don't suspect any liver enlargement. I will do the same thing on the left side, assessing for any enlarged spleen along the costal margin. I didn't hear any dullness under the costal margin, so I don't suspect any enlarged spleen either. I'm going to assess by palpation in all 4 quadrants. Any pain at all?
No.
No. Bimanual, assessing for the kidneys. I don't feel the kidneys, which is a normal finding. That's good. The next thing I'll do is I'm going to assess for rebound tenderness, assessing for appendicitis. Any pain over here?
Mm-mm.
Good. Can I have you turn on your side, please? Okay, lean forward, and I'm going to push this leg back. I'm assessing for the psoas sign. Okay, any pain at all in your right lower quadrant here?
No.
Okay, go ahead and go back on your back. And then next test will be for the obturator. Go ahead and flex with the knee. And then turn your inward. Any pain here in the right lower quadrant?
No.
Okay. Good. Next thing I'm going to do is assess the bladder. I'm going to palpate. I don't feel the bladder is not enlarged. It's non-palpable. The next thing I would do is I would continue on with the genitourinary exam. I'm going to defer the rest of that exam for right now. What I'm going to do is just explain to you. I would be looking at the urinary meatus of the penis. I would be making sure that there's no redness, there's no lesions, no discharge. The scrotum, I would be looking for any asymmetry, any nodules or masses, and any tenderness. For the women, I would be looking at the urinary meatus, making sure that there's no redness, no lesions, no drainage. I would also be looking to the external genitalia and looking for the same thing, no redness, no drainage, no lesions or masses. I would do a speculum exam on a woman to do the pap smear test, as well as the retrovaginal exam as well on her. The next thing I will defer is the rectal exam. What I would be looking for in the rectal exam is any, I would inspect first, making sure that there's no excoriation, no redness, any drainage, any lesions or lumps. Then I would look at the rectal area. That's in the peri area. The rectal area, I'd make sure that there's no hemorrhoids or internal or external, and no masses or lesions or anything like that. And then I would also palpate for the male, the prostate, making sure that there's no asymmetry and no hardness. The next exam I'm going to do is the lower extremity exam. I'm going to first inspect the general skin, making sure that there's no edema. The color looks symmetric on both sides, and there's no suspicion for peripheral arterial disease or peripheral vascular disease. The skin tone is good. The next thing I'm going to do is assess his ischial spines and his trochanter, make sure that there's no ecchymosis, no swelling, no tenderness to palpation. Good. And then I'll assess his range of motion. I will be doing this on both legs: flexion, extension, internal rotation, external rotation, abduction, and adduction. He has free range of motion. I will do the same for the knee: flexion, extension. And I would also, before I do that, I'd look at his knee, make sure that there's no swelling, looking at them bilaterally. And then I would go down to his ankle, dorsiflexion and plantar flexion, and rotation. No pain or tenderness during that exam. Then I would assess his femoral, popliteal, dorsal pedis, and post-tibial pedis on both legs again, and they're +2. Then I would go ahead and assess his ACL, grabbing behind the knee, and I'm going to give a little bit of a jerk. You let me know if you have any pain.
No.
No. And then I would assess his strength. Go ahead and try and lift up. Lift up. Good. And then pull down. And he's got a 5 out of 5 strength. Next thing I'm going to do is assess his sensory. Go ahead and close your eyes. Same thing as on the face. Sharp and dull. Just tell me which leg and which sensation you feel.
Sharp left. Sharp right. Dull left. Sharp right.
Trying to trick you.
Sharp right. Dull left.
Good. Okay, if I can have you sit up for me. Next thing I'm going to assess for is his deep tendon reflexes. First I'm going to start with the bicep, tricep, brachioradialis, his patellar. Oops. Good. And the Achilles. His deep tendon reflexes are a +2. The next exam I'll be doing is testing the Babinski. In an adult, I would expect the toes to curl down. In a baby, I would expect them to fan out. These are both normal findings. Sorry, it's going to tickle. Okay. And that is a negative Babinski, which is a normal exam. The next exam I'm going to do, go ahead and close your eyes. I'm going to be testing him for stereognis. I'm going to give you a foreign object. You just tell me what I'm giving you.
Tissue.
Good. Next, I'm going to assess your motor coordination. If you could, just tap your hands. Perfect. And then I'm going to have you I'm going to assess your lower extremities with your motor coordination. If you could just tap. 4, 5. Good. 1, 2, 3, 4, 5. Good. So motor, upper and lower extremity motor coordination is intact. Go ahead and stand up for me. I'm going to assess your spine first. If you could just flex down and up. Go ahead and extend back. Good. And then side to side. Good. No pain or tenderness?
No.
Good. Now I'm going to assess your coordination. Go ahead and do a heel-toe walk exam for me. Perfect. Come on back. Okay. Now I'm going to assess him for the Romberg. If you could, just go ahead and close your eyes. I'm just assessing your balance. Good. Perfect. While your eyes are closed. I'm going to stay close by. 2, 3, 4, 5. Good. And then go ahead and keep your eyes closed. Just put your arms out like that and keep them there for 5 seconds. 2, 3, 4, 5. Perfect. Okay. And that concludes our exam. Just wash my hands and we're all set. Thank you.